Hello and welcome to the award-winning Waterman Wellness, your pathway to whole person health, body, mind, and spirit. I'm your host, Kristen Ludicky. We have plenty of healthful information featuring local experts, including you'll learn one important word that can help identify if someone is having a stroke, and it may save a life. A Mount Dora mom shares her experience through a high-risk pregnancy. And how do you handle stress? You'll hear how one woman's focus on rest has transformed her ability to feel whole.
3, 2, 1.
First, Advent Health Waterman has a lot to celebrate. Recently, hospital employees, local dignitaries, and the community held a ribbon cutting for the new emergency department at the Tavares campus.
We are opening our 111,000 square foot 4-story tower, a labor of love, if you will, and a gift to our community of an expanded new emergency department, as well as a center for women and children. The environment is designed specifically around patients in pods so that our care team can focus and concentrate on group of patients that they will have. When our project fully completes, we will have 58 beds, and we would have more than doubled actually our square footage.
Learn more about the Advent Health Waterman expansion project by visiting this website. Early detection of breast cancer means a better chance of survival. We want to tell you about how new 3D technology is being used to help diagnose the disease, and it's coming soon to Advent Health Waterman.
So normal 2D mammograms, the kind of mammograms we've all been getting for the past 20, 30 years, are single X-ray images, one from the top down, one from the side. The conventional older mammogram technique, we struggle a lot with overlap of tissues to see masses and distortions and asymmetries, which can be early signs of breast cancer. 3D mammogram is an abbreviation for digital breast tomosynthesis. We're really excited about this because it's an improved, more accurate mammogram. It's allowing us to take a sweep of the breast and a series of images of the breast as opposed to one single image in each of 2 views. Because we are viewing the breast as a series of slices, it's a more accurate mammogram because we can see between the tissue elements to see those masses and asymmetries and distortions that pop out more clearly, so it's more visible to our eyes as well. So it's a faster, shorter mammogram. You're in compression for less time, so it should be an overall more comfortable experience, a faster experience. It's been shown to be beneficial in women of all ages, all breast densities. Research has shown that there's an increase in detection of invasive breast cancers by up to 40%. That allows us to see cancers earlier, more confidently, and so they can get to their doctor to get treatment faster. And it's a highly curable type of cancer, especially when detected early.
Patients who receive a breast cancer diagnosis may face a surgical procedure as part of the treatment. Advent Health Waterman is the first in Lake County to offer an advanced procedure that makes it easier for a patient in terms of comfort and saving time.
Savvy Scout is based on the radar technology. The Scout itself is a reflector which is implanted into the area of concern by the radiologist. And then once this reflector is implanted in the area, the patient then comes to the operating room, and then we have a detector which detects the strength of the signal emanated from the reflector, and then you make an incision over that area there and take out the area in question. So as you can see here, it's pretty tiny. It's smaller than a grain of rice. Normally, a breast cancer patient comes in the morning of surgery at about 6 o'clock or 6:30 in the morning. The actual needle localization of the tumor is done at 8 o'clock. This takes about 45 minutes to an hour, and the patient comes back to the holding area. So a patient coming in at 6 o'clock in the morning actually gets to surgery around noon or maybe later, and then is home late in the afternoon. The advantage of the Savvy Scout is that the reflector can be placed the day before at a convenient time for the patient, and the lymphoscintigraphy injection can be done at the same time. Once the Savvy Scout reflector is implanted in the breast, the patient doesn't feel it at all. And then when the reflector is actually removed during surgery, the patient is asleep already. So there is a huge difference in the amount of discomfort the patient experiences with the needle versus the reflector. As soon as they come in to the holding area, and once they're ready by the ambulatory surgery staff, they can just proceed to the OR right away and be done and be home by 9 a.m. in the morning. I just think it's a very a bright alternative to what has been, the age-old standard of needle localization. So this is an alternative which does not involve any radioactivity, easy to use, and patient-friendly.
Visit Advent Health Waterman to learn about advanced technology used in the diagnosis and treatment of cancer, available right here in Lake County. Next, we want to share an important word with you. It's one that can help save you or your loved one's life in the event of a stroke. Someone has a stroke every 40 seconds, according to experts, so it's important to know the warning signs and how to react quickly.
So a blood clot coming from either a big blood vessel or from your heart goes into the brain and plugs a blood vessel. Once a blood vessel is plugged, then that part of the brain does not get the oxygen, does not get the nourishment, then it dies. So whatever part of the body that brain controls does not work anymore.
Taveri's neurologist, Dr. Sam, as he likes to be called, says stroke victims should go to the emergency room immediately.
We can do a rapid assessment of you and administer the clot busters. So what the clot buster does is it dissolves the clot in the brain, reestablishes circulation and prevent the brain from dying.
Dr. Sam says patients may recover completely with physical and speech therapy after receiving immediate medical attention. He says to remember an important word to help identify when someone may be having a stroke.
The word to remember is FAST. The FAST stands for F for face, A for arm, S for speech, and T for time. So if somebody suddenly develops some facial drooping, then that is a sign of or potential stroke. If suddenly somebody starts having speaking difficulties, where the speech is garbled, or if they don't know what to say, or the speech is not coming out, again, warning sign of a stroke. If they suddenly developed tingling, numbness, weakness on one arm or one leg on one side, then that is the sign of a stroke.
Dr. Sam says it's especially important to go to the nearest certified stroke center, such as Advent Health Waterman, at the first signs of a stroke.
When a certified stroke center means, the center or the hospital meets the minimum standards to take care of a stroke patient. And it also, certifies that the facility is able to administer the clot busters, and also that facility has access to the neurosurgeons if a complication should arise from the clot busters.
Visit the website on your screen to learn more about the Certified Stroke Center at Advent Health Waterman. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. A Mount Dora woman is enjoying her new baby after Taveri's specialist led her through a high-risk pregnancy. A local surgeon explains how physical therapy plays an important role in his patient's recovery from joint procedures. And you'll hear from a Eustis woman who has taken the time that she rests to a whole other level. Check out Waterman Wellness magazine for even more health and wellness information. You can arrange for home delivery of the magazine by visiting watermanwellness.com. Plus, you'll find a listing of the specialists featured in this episode. Here are some community events that you and your loved ones might want to check out. Don't go away. Waterman Wellness will be back soon.
Scent is a powerful mood enhancer. Explore creative ways to make your environment more fragrant by adding a flowering plant or a scented candle.
Welcome back to the award-winning Waterman Wellness, your pathway to whole person health, body, mind, and spirit. I'm Kristen Luedeke. Well, having a baby is likely to cause anxiety for any woman. But what happens when your pregnancy is determined to be high risk?
AJ was kind of a surprise to us. We were really excited when we found out.
Even though she had delivered 4 other babies, Rosamond Blackshear soon learned that this pregnancy would be different.
Anyone over 35 years of age is considered like high risk, so I'm 37. It's just that you're a little bit older, so you want to make sure there's no issues with the baby, there's no issues with the pregnancy.
Rosamond went to her Advent Health Waterman OBGYNs, Mamie Rogers and Marilyn Main, who took charge.
One of the things that I think most people in the community don't know or don't realize is you can still deliver in your community hospital, and we work very closely and we collaborate with a high-risk specialist at the tertiary care center too, in terms of managing any potential complications.
The high-risk doctor was awesome and said that you can stay with Dr. Rogers and Dr. Main and even let me do my ultrasounds locally, because as a pregnant person traveling all the way to Orlando, that is like exhausting in itself. Dr. Rogers and Dr. Main, once they assured that everything was okay, they just took me step by step each time of what we had to get done. They would always transfer my results to me, and also the option that you could also look at your results online, and that helped me because sometimes when they're telling you everything, it's a lot to take in, so with the website you can look up everything that you were given and understand it better. I love the fact that when I did have any kind of worries in my head, that if I talked to Dr. Rogers or Dr. Main about it, they really helped me.
We are trained to deal with multiple deliveries for the most other things we can do with our here at this hospital. So they shouldn't be afraid that, okay, they have to deliver in Orlando.
So my experience here was awesome. I was so comfortable and relaxed because I had a lot of anxiety, just thinking about having to give birth. What if something goes wrong, But once I came in, everybody was so nice to me, and it just brought my anxiety level down. I felt like they made me feel like family.
You can find a specialist to help you and your family from pregnancy to adulthood by visiting the website on your screen. We turn to an important step in the process to overcoming joint pain in our next story. Local orthopedic surgeons say they often refer patients to physical therapy after a procedure.
Basically, after a knee replacement, you're in the hospital for 2 days or 3 days, and then you get discharged. When you go home, we have a home health nurse and a home therapist that comes to the house. Initially, the patient is not very mobile, and it's a lot easier for the patient to receive care at home, enabling them to get their activities going and their therapy going. And then once they're mobile, they can come to an outpatient facility.
Dr. Guru performed a total knee replacement on both of Robert Poirier's knees. After each surgery, Poirier received home health care visits.
Well, having the therapist come into my home was great because it forces you to do the exercises to get your knee back in shape. Otherwise, you might end up just sitting there for the day and not doing much of anything.
Most of these home health care agencies are in constant contact with my office. I get updates from home health as to how the wound's doing, how their range of motion on their knee's doing, and if there's any issue, then I can have them come in sooner so I can intervene.
I'd say within 2 weeks after the operation, I was getting off of the cane at that point in time, and I felt comfortable walking. Not fast, not long distances, but I felt comfortable standing or walking and being able to go where I wanted to go.
So having a good home health care team is very important and critical to having a successful outcome on any patient.
You'll find resources for getting rid of joint pain and getting moving again by visiting adventhealthorthowaterman.com. You may have heard the expressions whole person health and feeling whole, but what do they mean? We turn to Advent Health Waterman Mission Development Director Candace Huber for insight on how some members of the community apply the principles of creation health as their guide to feeling whole.
When we talk about creation health, it is one of the ways in which the Advent Health System has defined whole person living. Choice, rest, environment, activity, trust in God, interpersonal relationships, outlook, and nutrition, all of these help us to understand whole person living physically, mentally, emotionally, and spiritually. We have stress in our life today, and we have Kimby Ayers, who is able to share with us how she has overcome stress in her life, and you'll be surprised that sleep has nothing to do with it.
Sometimes you think you're okay and you're not stressed, and it starts to creep up on you. And a little bit here, a little bit at home, a little bit at work, friends, sometimes you start to feel alone. You think nobody else has those same problems, and that stress builds. At the beginning of the year, there was a lot of stress going on all over my life. And my husband and I are very close. We've been married 35 years, and we started figuring out different ways that we could reduce our stress. And we take walks at night, and we ride our golf cart around our land and enjoy the outside and the environment. I have a special chair at my house as part of my rest that I sit in. It's got my Bible where I want it. And I do get to that point, and I'll get home at night and I'm done. That's it. I crawl up in my chair and I stop. I read my Bible and I stop. Whenever I'm here and I need to walk and de-stress a little bit, I take a walk out on that mezzanine. You peek over the wall and you see people, they might be stressed themselves, or they might be really happy, or going home with their new baby with a balloon in their hand. On my phone, I have an app, it's a Bible app. Seeing God's Word written and being able to say it or speak it and then hear myself say it just calms me down. I know I keep talking about reading my Bible, but without that foundation and without that ability to know that the Creator in heaven cares about me and He comforts me and He makes me feel relaxed, I feel whole. I really do. Rest is very important to me. Some people might think that rest is sleep. But I purposefully get up an hour early every morning before I know I have to start getting ready for work, because I know I need that time to clear my head and to think, read my Bible, and just think about not what I'm going to be doing that day, but just think about my life and what my purpose is and what I want to do and dreams. My name is Kimby Ayers, and my ability to find rest makes me feel whole.
Want to learn more about how you can feel whole? Visit adventhealthwaterman.com. We hope you've enjoyed this episode of Waterman Wellness, your pathway to whole person health, body, mind, and spirit. To learn more about the experts featured on this program, please visit watermanwellness.com. Until next time, I'm Kristen Luedeke for the award-winning Waterman Wellness.